Dear colleagues, ladies and gentlemen, good morning from Tehran, Iran. I hope all of you are safe and healthy in this COVID-19 pandemic, and I wish that we can meet each other very soon after the pandemic has been controlled. I'm going about the biopsy of chronic wounds, when and how. I have no conflict of interest for this presentation. I'm briefly going to provide an introduction about the biopsy of chronic wounds, indications and the contraindications, how to select the site for biopsy, which supplies are needed for biopsy, the techniques and types of the biopsy, how to process the biopsy specimen, and finally a take-home message. The skin biopsy can provide valuable diagnostic histological findings in chronic wounds, and additional biopsies can be processed for identification of infections or immune complexes. A biopsy should be performed on any ulcer that is not healing at the expected rate for an undiagnosed cause or an additional etiology. But clinicians are often reluctant to perform a skin biopsy due to a paucity of clinical experiments in performing the procedure, or the lack of equipment, or concerning about complications such as bleeding, infection, and delayed healing, especially in chronic wounds. The indications to do a biopsy is first to make a diagnosis for the etiology of a wound, to rule out malignancy of a chronic wound, and also to obtain tissue for bacterial culture or to identify other infecting organisms. There are two relative contraindications for a wound biopsy. One is the blood dyscrasia because it has the risk of uncontrollable bleeding, and also the second is venous congestion and extremely vascular wounds in arterial insufficiency in a setting that the access to care is limited and or the biopsy wound is unlikely to heal. Before doing a biopsy, you should consider and ask the patient about the allergies to topical antibiotics, antiseptics, anesthetics, tapes, or adhesives, about bleeding disorders or any previous history of excessive bleeding, medication history, special medications interfering with hemostasis such as acetyl salicylic acid or warfarin, and also any risk factor for bacterial endocarditis that may require antimicrobial prophylaxis, such as heart valve defect or artificial valve or joint or a pacemaker. The most important consideration is to select a suitable site for the biopsy. Except for cases in which the pathology is definitely confined to the epidermis and superficial dermis, this biopsy should be deep, including epidermis, dermis, and subcutaneous tissue. Usually, the biopsy is taken from a fully developed lesion. If there are vesicles, bulla, and pustules, we prefer to do a biopsy of a recent lesion within the first 24 hours. In the case of vesicle and bulla, the biopsy should be taken from the edge of the lesion to avoid the epidermis separating from the dermis, or to remove an intact small vesicle. Older lesions may be dominated by secondary inflammatory changes, which will obscure the main pathology of the lesion. If a malignancy is suspected, the biopsy must include the wound bed and also some surrounding normal skin. In addition, some patients may require multiple biopsies from different areas of the wound, both from the periphery and also the center. For patients with blistering diseases, separate specimens should be sent for direct immunofluorescence studies. In such cases, the biopsy must be performed from normal skin adjacent to the blister. For ulcers caused by vasculitis or lupus and other inflammatory or autoimmune conditions, a recent lesion is preferred for the site of the biopsy. Some supplies are needed for doing a biopsy: an antiseptic agent, a sterile gauze or cotton balls, syringes for anesthesia, lidocaine 1 or 2% with or without epinephrine. Occasionally, we will do a biopsy with scalpels or with punches. It depends on the etiology and site of the lesion. Small surgical forceps, needle holder, tissue scissors, aluminum chloride for hemostasis or an electrocautery machine for hemostasis, suture materials, usually nylon material is used, antibiotic cream or ointments, non-adhering dressings, a bottle containing 10% formalin to put the specimen in it with the name of the patient and details of the biopsy sample on it, instructions for the patients for the care of the biopsy site, and also a pathology requisition form to provide enough information to the pathologist. The skin should be prepared and cleaned with an antiseptic. The site of biopsy should be marked. Local anesthesia is injected. Then the specimen is removed. Coagulation is done and the wound dressing is applied. This is the technique of doing a biopsy. It's very simple. The type of biopsy, depending on the pathology, can be an incisional biopsy, such as a shave biopsy or a punch biopsy, or an excisional biopsy. Each specimen should be placed in a separate bottle of 10% formalin with a specific attention to label the name of the patient, the date, and the site of each biopsy. The pathology requisition form should be filled, containing a brief and relevant clinical history with a description of the lesion. Most specimens are processed for H&E staining to examine the morphology and cellular detail of the specimen. In some cases, for considering the differential diagnosis, the pathologist may order for special staining done on the formalin-fixed specimen. Specimens for DIF, usually for autoimmune blistering diseases or collagen diseases, should be placed in a special transport media, usually Michel's media. For electron microscopic studies, the specimen should be fixed in glutaraldehyde. If an infection is suspected, a separate biopsy should be done for tissue culture, put in a sterile container, usually the kind of bottles which are used for urine culture, with or without addition of a non-bacteriostatic preserved saline, and submitted to the laboratory. Some molecular studies require snap frozen tissue in liquid nitrogen or carbon dioxide for transport and storage in -40 degrees specialized freezer. So, in conclusion, do not hesitate to do a biopsy in any chronic ulcer. Select a suitable site and the most proper technique. Use an appropriate storage and transport medium depending on the required study. And occasionally, multiple or serial biopsies might be necessary, and both the patient and the physician should admit this need. Thank you very much for your attention.